Well, let's talk to the National Clinical Director, Professor Jason Leitch, who's with us now. Good morning to you, Professor Leitch.
Morning, both.
Can I just ask about the number of people, the figures for yesterday? The number of people who tested positive for COVID yesterday was just over 7,500. That was just about half of the figures compared to Friday. What do you put that down to?
Single days are really difficult to interpret, Laura, so I would suggest we wait a few days to let the weekend numbers move through, the New Year numbers move through. And remember, we made some very, very significant changes to testing last week, where we stopped asking people to get confirmatory PCRs after they get a positive lateral flow. So our data needs to catch up with that. So we're working in the next few days to be able to publish positive lateral flows plus positive PCRs. That'll give us a more accurate assessment of the pandemic across the country. But that's just going to take us a little while.
From what you've seen already, are people self-reporting their positive lateral flow tests?
Last numbers I saw was about 80%, which is great, but not 100%. And PCRs did have the advantage of you having to go somewhere to get them, of course, which allowed us to kind of capture your data. So we do really, really need people, just for accuracy, to tell us their lateral flow test, both for the data, but crucially also for test and protect to be able to start contact tracing. So we are giving some slightly more responsibility to people. Remember, some people are still going for PCRs, those with symptoms and other categories still getting PCRs. But if you've got an asymptomatic positive from a lateral flow test, then you should register that on the UK government website. That would really help us. And
you'll then get those figures and be able to put those out separately later this week, you think?
Correct. Now, that's slightly more complicated than it sounds because, remember, people do multiple lateral flows. So we've got to call what we've got to do. This is not even a real word, I don't think, but the statisticians call it deduplication. So you don't want to, if I get 4 lateral flow positives, you only want to record me once in that week, for example. So you've just got to be careful you don't overcount or, of course, undercount. So it just takes a little bit of time to remove that noise from the data.
And I know all of this sounds a bit dry, but what I'm trying to get to is, are you expecting the cases to shoot back up again this week? Because the latest modelling suggests that Omicron could peak as early as this week. And that's a lot earlier than you were predicting.
Well, that's not really much earlier than we predicted. We predicted mid to late January and we're on the 10th. So it's not that far away. Cases are up 62% on the daily 7-day average, and we're at over 2,000 per 100,000. I mean, a year ago, we'd have been locked down. 6 months ago, we'd have been locked down. The difference, of course, is vaccination. Hospitalisations, though, are up nearly 40%, and intensive care is now up 16%. It's entirely predictable. You get 3 waves. You get cases, hospitalisations, and intensive care admissions. That's what always happens. We've done it 4 times now. What's crucially different is we're not getting as many hospitalisations or as many intensive care cases, but they're still significant because of the huge number of cases. So it still worries us.
Just in terms of the number of cases per million, the Scottish Government's State of the Epidemic report showed an average of just over 2,800 cases per million here up until last Thursday. In England, that figure was just 2,600. Does that suggest that the increased restrictions here that came into play just after Christmas haven't actually made much of a difference?
It doesn't. It's per 100,000, not per million. But
apologies.
The differences between the 4 countries are quite minor, actually, in terms of both restrictions, but also in terms of that data. If you want to do the comparison, Northern Ireland's number is much higher than ours. Wales is higher. England and Scotland are very similar. We were lower than them. Now they're catching up a little bit. Single weeks numbers are really, really difficult to interpret. And different countries have made those lateral flow test differences, etc. The Office for National Statistics, which is the household survey where they do about 60,000 random households a week, suggests that Scotland still has the lowest case rate in the UK, but it is coming closer together. You're absolutely right. Omicron is really, really difficult to avoid. So it's in our power. Vaccination, testing and following the rules within our power. But it is really, really difficult to avoid this virus.
Well, I'm asking just because if Omicron, if we think it's going to peak slightly earlier, and these figures between England and Scotland aren't all that different, I'm wondering, does it raise questions about restrictions which will be looked at again on the nighttime industry and large events, including big sporting events? What is your advice now to ministers if you think that all these things are coming ahead earlier? Can the restrictions be lifted?
Well, I disagree with your premise, remember. I don't think it's earlier than we predicted. I think it's exactly when we predicted. If you look at the modelling, we said mid to late January for the peak. But your fundamental question is fair. Should we still be protecting the public from these case rates if they're just going to go anyway? I think yes is the answer to that. I think the protections reduce the size of the wave, and they potentially also elongate the wave to allow you to get more people vaccinated, allow you to spread the hospitalisations and intensive care cases out over a longer period. That's got to be good. Now, that's not always good if you own the pub or you own the nursery and people are having to self-isolate. So it's a real balance in there between the number of cases, the number of people off work, and we've tried to make some adjustments in our advice to allow people to do that. But I still think it is the right thing to do to try and reduce that case rate, even if it's not as severe a disease, because, as I said before, if you're at 2,000 cases per 100,000 over a 7-day period, there is no way up until this point, after a year of vaccination, we'd have been allowing what we're allowing around the country.
But if it's not making that much difference in terms of the figures in England, then why should people here be restricted? Why should people here have businesses problems because of this, when in England they don't, and it's not making a difference to the figures?
Well,
it's not protecting anyone.
It is protecting people, let's be clear. It isn't no restrictions in England. The restrictions in England are face coverings, work from home when you can, there's distancing, there's all kinds of human behaviour changes across every country in the world. So let's go to the Netherlands instead of England and find a much more restricted country than in Scotland, a much more severe version of these restrictions. Every country is finding a balance between their moment in the pandemic, their science, whether they've got testing, whether they've got vaccination, and what they think the predicted next steps are. The government tomorrow, not me, the elected government tomorrow, the Cabinet and the First Minister, will look at the data that you've just described from Friday, the big evidence paper that was published by Public Health Scotland, the state of the pandemic, looking at the number of people vaccinated, the difference vaccination is making to cases, to hospitalisations, to deaths. Very, very significant differences, but still a very high case rate. The
UK government is currently thinking about reducing the isolation period from 7 to 5 days. What do you think, what are you advising ministers here about that?
I think it's far too early to make that decision or choice. We've only just gone from 10 to 7. We went from 14 to 10, if you remember, some time ago. Now we've gone from 10 to 7 with quite a lot of extra steps in there, a couple of tests, vaccination, all those other things to get released if you possibly can. But there's no suggestion yet that we should move to 5. They've done it in some limited parts of the world, but the data suggests that's a risk, particularly at high levels of infection. So we're not intending to do that. And just finally and briefly, if you wouldn't mind, we know there's been a lot in the papers this weekend about the UK government possibly stopping free lateral flow tests. They've denied that is the case for the moment. Is the Scottish Government making any contingencies about keeping lateral flow tests available here if the UK Government changes its mind? We do that for countrywide. We procure for countrywide. We distribute for countrywide. We have no intelligence at all that story is true. So we're carrying on, anticipating lateral flow tests will be freely available to the population. But not making any contingencies in case the UK government decides. We think it's a red herring. We believe the UK government when they say it's not true. Professor Jason Leitch, thank you once again for your time this morning.
Now, the time is 8:16 and some of the issues raised there are the subject of the phone-in from 9. Case here. Good morning.
Yeah, but I'm just picking up on that, actually. Jason Leitch saying we have no intelligence to know that's true. We think it's a red herring. And yet both Hamza Yousaf and Nicola Sturgeon yesterday tweeted that, that they would be outraged if this was to happen, etc., etc. So clearly that intelligence must have come in over the last 24
Possibly.
hours.
Yeah, absolutely.
Well, we're in a strange time, aren't we? Because there's been a lot of conversation over the weekend about planning for the end of the pandemic. We've had Dr. Clive Dix, who's the former vaccine task force head, saying that we need to move from pandemic to endemic and ease towards a new normality. And of course, Nadeem Sahawi also saying that we should be planning for treating this like an endemic virus.
Yeah.
So
we've just been speaking to Professor Mark Woolhouse just about 15 minutes ago, and he was making the same point. He said that we need to move.
So can you see the end of the COVID tunnel is what we're asking people this morning. Not exactly where it is going to be, but can you see the end of the tunnel now? Or is that jumping the gun? And when you listen to Professor Jason Leitch there, you think perhaps, in his view, it is jumping the gun. So where are you on that journey?